With the patient supine and the therapist sitting in a chair, flex the elbow to 70 degrees and supinate to 10 degrees. Using one hand, lock the distal part of the humerus and lock your hand on the table. You can place the patient's forearm on your shoulder. Using your fingers, hold on to the ulna and in a distraction force. This can be used as an assessment as well as a treatment to improve it. With the patient supine or seated, stabilize the humerus against the table with one hand. With the other hand, grab onto the radial head and apply a distraction force. This is a general mobilization to help improve flexion. With the patient prone, fully extend the elbow and supinate the forearm. Stabilize the humerus against the table and apply an anterior glide to the radial head. This can be done with the hand on the table, or it can also be done by placing the patient's wrist between your legs to add a little bit of traction to the humeroradial joint. An anterior glide should still be performed at the humeroradial joint. With the patient supine, place a towel roll under the distal humerus to help keep the humerus parallel to the floor. Stabilize the distal humerus and passively flex the elbow as much as able. Repeat multiple.
During your assessment of triceps length, you may have noted a loss of elbow. So an assessment and apply a soft tissue mobilization technique to improve the mobility of the soft tissue. As the restriction is reduced, the patient can then be brought into a stretch position.
elbow extension. احنا شفناه في البوستيريور glide.
With the patient supine, extend the elbow and supinate the forearm. With one hand, stabilize the humerus on the edge of the table, while the other hand palpates the radial head and applies a posterior glided mobilization. Multiple repetitions should be done to help improve elbow extension. With the patient in prone, flex the elbow to 70 degrees. And supinate to 35 degrees for an open pack position. With one hand, stabilize the ulna against the table, while the other hand uses your thenar eminence on the radial head, providing an anterior glide. Multiple repetitions should be done at end range to improve supination at the proximal radial ulnar joint. With the patient supine, apply a cream to the pronator teres muscle, and then using your thumbs, slowly apply a deep pressure, moving from distal to proximal along the pronator teres muscle. Multiple repetitions are required to improve mobility and deep. With the patient supine, flex the elbow to 70 degrees and supinate to 35 degrees to an open pack for the proximal radial ulnar joint. Stabilize the forearm on your leg and use your hand to stabilize the ulna. Using your thenar eminence, come up over the radial head and apply a posterior directed force to the radial head. This is an assessment as well as can be used as a treatment to improve pronation at the proximal radial ulnar joint. Multiple bouts of 30 to 40